We are joined by Brooke Klatt, who will provide insights into physical therapy techniques and their benefits.
Hi, my name is Brooke, and I'm a physical therapist at the University of Pittsburgh Medical Center's multidisciplinary MSA clinic. Working at this clinic has been one of the most rewarding and meaningful experiences in my career. I've seen firsthand the positive impact we can make together with small changes, and it is inspiring to work with such a resilient and remarkable population. It is truly an honor to be a part of this MSA Spark conference. Thank you so much for having me. I have aligned the objectives for this talk with the goals that Mission MSA has outlined for this patient and family conference. By the end of this presentation, it is my hope that you will remember that exercise can energize us all and boost energy levels. My goal is also to empower you to take an active role in your exercise routine and seek physical therapy services when they are needed or when they are recommended to you. Most importantly, I hope that this talk ignites a fire within you to confidently take action to safely start an exercise routine or build upon what you're already doing to fully maximize benefits. I'd now like to start the talk by reviewing how exercise can energize, empower, and ignite you during physical therapy. We know that exercise can boost physical energy by building endurance and fighting fatigue. Exercise also elevates mood by releasing endorphins with movement, which improves emotional well-being and increases energy. Additionally, studies show that exercise enhances attention and focus, boosting cognitive clarity and reducing mental fatigue. Engaging in exercise creates momentum to help you tackle your daily challenges. For example, imagine starting your day with a 10-minute walk or 10 minutes of seated exercise for strengthening and flexibility. That accomplishment not only increases your energy in and itself, but it also builds confidence, making the rest of the day feel more manageable. By establishing a regular routine, you create a domino effect. Each small victory fuels your motivation to keep going, approaching daily tasks with more energy and resilience. Exercise during physical therapy can significantly build your confidence, which is empowering. In physical therapy, we celebrate the small wins just as much as the big wins. For example, we often start by practicing simple tasks, and over time, progress the level of challenge and decrease the level of assistance, which can boost confidence. Tailored interventions help you stay engaged in meaningful activities and can promote independence. By consistently exercising, you can improve your self-efficacy or your belief in your ability to succeed. For instance, in physical therapy, you might learn gentle yoga stretches that help reduce stiffness. And then if you feel stiff, you can use those stretches and take control of your symptoms, improving your self-efficacy. Exercise also fosters mental and physical resilience. Completing exercises that mimic real-world tasks can help you be able to adapt to the challenges that you face in the real world. No matter where you are in the progression of MSA, physical therapists will meet you where you are and prescribe exercises that address your specific needs and can empower you in these ways. Exercise in physical therapy can ignite motivation and drive long-term change. We often start with small achievable goals. So maybe the goal is to complete 2 minutes of light stretching in the morning. You can track your progress, highlight improvements, and this can motivate you to continue or progress what you're doing. We can also identify barriers and modify the program to best suit your needs through this process. Exercise can also inspire change and lead to lifestyle adjustments. Aquatic therapy, for instance, might be introduced as a fun and accessible method to manage joint pain or limited mobility. If someone has a positive experience with this exercise, maybe they adopt aquatic therapy into their regular routine and establish a new long-term habit. Aquatic therapy definitely is not for everyone, and your PT will work with you to find an activity that cultivates your passion. Finding the right activity makes a big difference. Maybe the physical therapist introduces an exercise similar to Tai Chi or meditation that really makes you feel good and addresses your impairments and is equally as beneficial to you. Exercise also can motivate action. PTs support their patients by offering education and collaborative planning. Together with caregivers, they can develop personalized plans, which might include ways to connect with resources like adaptive fitness classes or online programs to achieve physical therapy and fitness goals. So who are physical therapists? We are doctorally trained movement experts. We play a vital role in assessing and addressing the movement and functional mobility needs of people. And specifically in people with MSA, we can evaluate gait, balance, and functional mobility and create a personalized exercise program that tailors specific goals and deficits. These programs can be done at home or in physical therapy clinics. And we can also recommend assistive devices that enhance safety and efficiency. Some key principles for physical therapy. We believe that exercise should be tailored to each person's abilities and needs. We typically start slow and gradually increase the intensity, and often in incorporation of different types of exercises, including stretching or flexibility, strength training, and aerobic activities, as well as balance and gait and functional mobility tasks, really ensure that we're developing a well-rounded program. And safety is always a priority in our plan of care. We recognize that MSA symptoms affect motor and non-motor functions, and neurologic PTs can identify these impairments to provide targeted interventions. These targeted interventions can address rigidity, tremors, and autonomic symptoms like blood pressure, instability that are common in people with MSA, as well as offering strategies for things like sleep disturbances. So by recognizing the common symptoms, we use that to guide our exercise plans, referrals, and establish the most beneficial PT interventions for each person. So while physical therapy and exercise are not going to stop the disease progression, it's widely appreciated that it might be helping slow down the progression of the disease. And the exercises and interventions in physical therapy can really help manage the symptoms that frequently present in people with MSA. General goals for physical therapy in management of MSA are to maintain mobility and independence, improve balance and prevent falls, address specific movement and functional impairments identified during the assessment, and overall, we really strive to enhance quality of life. It's been mentioned a few times, but it's important to reiterate that in physical therapy, we really work together to create specific patient-centered goals that are based on each individual's needs. And address also, the goals that people have, but also the symptoms that they're presenting with and the impairments that are impacting their daily lives. A disclaimer, MSA progresses differently in each individual, and everyone has unique needs from physical therapy. So the information that I've presented and I'm going to continue to present is not a substitute from getting professional advice from a licensed physical therapist, preferably one who is specialized in neurologic physical therapy. And this is something that you would want to do before you would start an exercise program, because they can help you develop a customized program that's tailored to your needs and that will ensure safety and, again, maximize the benefits for what you need. Typical interventions that might be considered in this customized program for a physical therapy plan of care for someone who has MSA includes aerobic exercise, strength training, flexibility and stretching, balance and coordination, functional mobility, which is bed mobility, moving and rolling in bed, and transfers from different surfaces, sitting and standing, gait training, and education. Regular aerobic exercise improves cardiovascular health, helps maintain energy, and combats fatigue, which we know is a common symptom in MSA. Activities like stationary cycling or walking can enhance endurance without causing overexertion. And these exercises can be adapted to your fitness level and modified accordingly to progress or to make easier as needed. For best results, aerobic exercise should be completed 3 to 5 times per week. Strength training is an essential in physical therapy management for people with MSA, where we're really focusing on building strength of the large muscles or specific impairments that are identified on the assessment to help improve function. So by increasing strength, we can enhance mobility. It also impacts balance and posture. And ultimately, by having the strength needed, you can reduce your fall risk. For MSA, exercises do often target those large muscle groups like the legs, back, chest, and core, because they're really important for function in daily activities. You don't need fancy equipment or heavy weights. Body weight exercise, leg lifts, moving from sitting to standing are really effective ways and accessible options for strength training. We aim for strength training to be completed 2 to 3 times a week for best results. Daily stretching is vital for maintaining flexibility and preventing tightness that can limit movement. We focus on areas that are prone to stiffness, like the hamstrings, calf, and neck, so that you can improve mobility and reduce discomfort. Certainly, you can address other areas that are identified in the assessment. But stretching your hamstrings and calves, we know enhances walking and standing, while maintaining good flexibility of the neck can help reduce pain and also supports the head during movement, contributing to your overall balance. So this is a daily recommendation for, this regular stretching to increase range of motion, improve posture, and lead to efficient, smooth, controlled movement during functional tasks. Balance and coordination are crucial for safety and independence. So these are key focuses in physical therapy care for people with MSA. We address static balance, which is standing still or sitting still, and also dynamic balance, which is having good stability during movements, controlling movement. So this is what we have when we're walking or when we're reaching. Since balance work can be challenging, safety is prioritized and often supervision or assistance is recommended. And with regular practice in these types of exercises, balance and coordination, we know that we can improve stability, reduce fall risk, and we also see increased confidence with activities. Functional mobility, like bed mobility, rolling in bed, and sitting to standing transfers are really vital for independence and safety. So we can focus on how to be most efficient when you're rolling or sitting up, how to be safe when you are moving from the bed to the chair. And this includes using proper techniques that will prevent strain or injuries. In these situations, we often do real life tasks as well, like car transfers. And we can consider the inclusion of assistive devices like grab bars or slide sheets to increase your safety and increase the ease in which you perform your transfers. Gait training. Here we're thinking about your walking safety and your efficiency with movement in the community as well as within your home. So we look at your stride length, your foot clearance, your cadence, the placement of your feet, and give you cues to move in the most efficient pattern. Balance exercises are also incorporated into gait training to reduce fall risk. In some cases, we can recommend assistive devices like canes or walkers or orthotics to add support, improve safety, and allow you to move in the most efficient and preferred movement patterns. We also practice walking in real world situations, get you ready for the challenges that you need to be able to negotiate and navigate, such as stairs, curbs, uneven surfaces. And with regular gait training, we can improve the walking pattern itself, which leads to reduced falls and also increases confidence in your daily activities. There are lots of pieces of education. One of the most common is regarding fatigue, because it is important and prevalent in MSA. We stress how important it is to listen to your body, taking rest breaks and using energy conservation strategies that we focus on in your PT plan of care can help you stay active without overexerting. A home exercise program is part of the PT plan of care. This is really important to complete consistently so that you can reinforce and continue to make progress. So we know that the PT sessions are important, but most of the exercise that's completed is going to be done outside of those sessions to see lasting benefits. So really important that you work with your PT to create a personalized plan that fits your lifestyle, your goals, collaboratively with your family and caregiver. The program should be manageable, but challenging enough to also see progress. And we believe it's really important to track progress for accountability and motivation. And see that consistency, because consistency is really key to seeing the benefits of exercise. So some strategies for consistency are to set reminders or complete the home exercise program at the same time every day, have the support system, and celebrate all the successes that you have, the consistency that occurs. Because by committing to this daily practice, you're going to build momentum, support your recovery, and continue to reap the benefit from exercise. I want to make a note how important it is for caregivers who play such a vital role in supporting exercise routines for people with MSA, for them to also prioritize their own self-care and exercise. So please, caregivers, family members, make sure that you're maintaining your own well-being so that you have the energy to assist your loved one effectively, offer motivation, and celebrate the wins that you both have together to boost morale and reinforce consistency. do want to make note that it's important to know that not all PTs are equipped in the same way to provide specialized care for someone with MSA. Uh, PTs with expertise in neurologic physical therapy can offer tailored, evidence-based treatments that address movement patterns, cognitive impairments, balance deficits, and coordination challenges. And specialized neurologic PTs have access to resources and support systems that might not be available in a general practice. They're connected with multidisciplinary team members who also have neurologic expertise so that this comprehensive approach that really optimizes recovery can be created. So I encourage you to seek out physical therapists with specialized neurologic experience and don't hesitate to ask them about their qualifications or their ideas about treatment plans. You can find board certified neurologic specialists through this website, the American Physical Therapy Association's Find a PT directory, or certainly the PTs that are practicing within the MSA Centers of Excellence are great resources to tap into. So thank you very much. I look forward to the Q&A. If we run out of time, my email is here, and I'm happy to continue the conversation or support you via email communications.
Okay, thank you, Brooke, for that presentation. We have a lot of questions that have come in during it. So we'll just jump right in and I will ask you them. Okay, first question. Can physical therapy help manage non-motor symptoms of MSA, such as speech or swallowing difficulties?
That's a great question. So the very specific and targeted exercises that will help with speech and swallowing would best be addressed by the speech and language pathologist on a multidisciplinary team. But I think, physical therapists, we all support each other and reinforce what is going to help you best. And certainly having good posture is something that is going to help speech and swallowing. So indirectly, I say yes. Physical therapy can help you with your posture to allow you to, get all of the benefit that you're getting from the exercises that the speech and language pathologists are recommending.
Awesome. And we actually do have a question about posture. Are there specific exercises to improve posture and prevent falls?
That's a great question. And yes, this is one, and I don't want to say, it's gray, but it really does depend on the person and what's going to be best for them where they are. But some basic exercises that are going to keep you upright. So often, a simple exercise where you're squeezing your shoulder blades together to help you get into that upright position. But if you have tightness in other areas of your body, like your hamstrings or your hip flexors, the specific exercise that's going to be best for your posture, is going to be very individual. So there are some basic things that keeping good flexibility and range of motion in your neck going to help your posture, going to help your balance. And then depending on where your muscle tightness is, would direct the best stretch or best posture and balance exercise for you.
Right. What role do assistive devices like walkers or braces play in physical therapy for patients, and when are they typically introduced?
Yeah. So this is a great question as well. I think a lot of times people think of them primarily as being for safety and keeping you as independent as possible, which is 100% accurate. So if you're starting to realize that you might feel a little unsteady, it's, appropriate to consider a cane or a walker to keep you safe, to keep you independent. But I would also argue that often using a device can help you conserve energy and move efficiently with the optimal pattern. So sometimes you might be able to walk without needing assistive device for balance or independence. But if you're starting to, um, if you're having some problems lifting up your feet, you're dragging your feet, that use of a walker might be able to help promote the right pattern. So there are a couple of different times that I think a walker or other assistive device can be really helpful in in keeping you safe, but also in helping you move efficiently and smoothly with the correct pattern that you want to reinforce.
Yeah. I think you just answered two questions in that one question, so that's great. And what is the best way to prevent muscle stiffness?
Oh, that's a good one. Movement, right? If you don't, kind of the same with strength. If you don't use it, you lose it. But same thing, if you're not moving, your muscles are going to get tighter. And this can be, when I say movement, I don't just mean walking. You can move when you're seated. You can move um, when you're in bed. You can move with help. If you're having trouble laying in bed and moving, a caregiver, a home physical therapist, or a home aide can help you move your extremities and your head to keep neck range, which will help you be pain free. So movement and stretching every day is the best way to address tightness and stiffness and to prevent it as well.
Yeah, great. Um, I know you briefly touched on this, but are there any specific techniques for assisting with transfers to avoid injury to myself or them?
That's a really good one. And often when I address this with my patients, I mean, one of the best ways to see it is to be in your home environment so that we can work with you specifically with the transfers that you're completing, helping your loved one complete. Um, the basic body ergonomics of wherever you are, if you're transfer helping someone move from laying down to sitting up, making sure that you're keeping your core engaged so that you're protecting your back and bending at your knees, making sure you're not just bending from the waist to assist with the transfer. This question is so important, such an important point. So I'm glad it was a question because all of you who are helping with movement, you need to protect your body. And so to answer that to the best, in the best way, this is where I really do think sometimes the physical therapy visits are, while they're primarily for the person with MSA, the caregivers can also be part of the treatment session and learn those techniques and kind of brainstorm together because it really is a collaborative process. So I can tell you to tighten your core, which is important, but I think the best advice would be from someone one-on-one who can talk to you about your specific environment and absolutely important to keep yourself safe so that you can help your loved one and continue your mobility.
Yeah, and that actually kind of goes with this question. Is outpatient PT more beneficial than home health PT?
So I will say there are benefits to both at different stages in the disease. It's probably most appropriate to be at home. If you can get outside of your home, I strongly believe that getting to outpatient clinics is the best because it's going to engage you. You're going to get outside of your house. And there are certainly times where home care is most appropriate, home PT is most appropriate. But if possible, getting out to the clinic, there are, different devices, equipment that you can use. The intensity of the program can meet your needs wherever you are, but it does seem that sometimes our specialized neurologic physical therapists are out in the outpatient clinics. So getting That exposure to specialists is really important, or, making sure that you are being treated by someone who understands MSA.
Yeah, great. Bouncing off of that as well, what should we focus on most in the early, middle, and later stages of the disease?
So I think you can think, in the early stages, um, you're listening to your symptoms, you're learning, so the education and really preventing um, the tightness that might happen if you don't move, and establishing a regular exercise routine that's going to, we think, slow the progression of the disease. So, a regular walking program, cardiovascular fitness is important, stretching daily, some light exercise for strengthening is also good. And then I think as some of the impairments become more pronounced in the middle stages, then that's where we can really target um, specific gait and balance exercises to address whatever it is that's giving you trouble. Whereas more in the later stages, for someone who might not be able to walk as far or at all, then we're really focusing on more of um, the movement and exercises that are going to keep you pain-free, reduce any pressure that you might be getting from sustained positions. So the consistent thing across all stages and for all people is that you're going to do as much movement as you can, keep your flexibility, and then, I think this is where PT can play a really great collaborative role, because it's going to depend on what's bothering you, how we can help you in this collaborative effort to design the program. So it's hard to say exactly what you should work on, because it really is based on your symptoms and your needs. But I think generally that's how I would think about it.
Great. And then how often should DME be evaluated or updated as MSA progresses?
Yeah, that's a great question. So for those that might not know, DME, durable medical equipment, that includes walkers and canes. It also can include grab bars, sliding, um, assistance for transfers to help with the movement to slide without getting like a shear force. So that to me is something that should be constantly being assessed. And then when a caregiver or a patient is realizing that there's, increased difficulty doing certain things and the device just doesn't seem to be cutting it, that's when I would either bring it up with the PT if you're currently seeing them, or if you're not, trying to get back in to reassess. So sometimes it's every couple of months. Sometimes it might be 6 months, sometimes it might be a year. It's another one of those, address it when the need is there.
Yeah.
It's better to address it early and, rather than to wait too late and not get the maximum benefit. So I really do hope that this, you're empowered to take control and to start some of these things, because sometimes your neurologist might not know that you're having trouble with a transfer because they don't see that if you're having trouble getting out of bed. So if you kind of take that initiative and say, hey, I'd really like to talk to a physical therapist to see if there are ways to improve this, and empower yourself to initiate that action to get the advice that you need.
Yeah, and then we have more questions, but we're not going to be able to get to all of them in this time frame. We do have one. How often do you see a patient with MSA-C? MSA is covered by a blanket of remedies.
Yeah, so the cerebellar variant, the subtype, I work in a multidisciplinary MSA clinic, so obviously not as common as the type P, but I don't know exact percentages. I'm going to take a guess, 1 to 2 out of 10. And I don't know exactly if that matches what the statistics say. But with, and that it's a really good point because sometimes the symptoms are a little bit different with that presentation where balance and ataxia, more gait pattern that's unsteady, are often more prevalent. So again, having a PT that understands that, most PTs will still be able to help you address whatever impairments you're presenting with. But it is, as I'm sure the person who asked the question knows, less common. But for those of us who specialize in the care and serve people with MSA, we do see people with type C as well.
Okay, I'm gonna ask one more question that just came in. Getting an appointment is challenging. Are there any YouTube videos that you would recommend?
That is a really good question. I'm not against YouTube videos at all, but I think to know which to recommend, you need to have an assessment. And I completely appreciate the challenges with scheduling. And I think, if you can find a specialized neurologic PT, they will work with you and create a one-time visit so that you can create that plan together. And at that visit, they could recommend YouTube videos or, a specific exercise program. But without knowing everyone, I'm sure on the call is, very, very different. All people are very different. So to recommend a YouTube video, without knowing what's giving you difficulty, I'm not able to do. But your PT would be able to do. And know that just because you start PT doesn't mean that you have to go for 3 times a week for 6 months, and actually sometimes that is a problem with insurance as well. It's our goal to work with you to create the program that you want. So maybe that is one visit and your caregiver is really involved and can help you do all the things that you need to do at home, or show you the YouTube channel or community exercise program to empower you to do it, the things that you want to do.